Hey everyone, good evening. This is Dr. Karen Sullivan. I am a board certified neuropsychologist and I am here with you once a week. I do my best to make that happen on Wednesdays at 6 o'clock to give you a free brain health lecture. And my goal is to give you the highest quality scientific information and psychological support possible for those of you living with a brain health challenge. Sometimes we talk about specific conditions, sometimes we talk about specific interventions, and sometimes we talk about things that would really apply to many of us out there, even those of us who are clinicians or caretakers or rehab professionals, and that's what we're going to do tonight. We are going to talk about the power of music to soothe us, to transform us, to help us work through symptoms, to help us get better rehab outcomes, to help us keep our mood positive and on track, and sometimes even help us process emotions, to help us grieve, to help us see other choices, to help us find resolution in some of the things that I know you guys are out there struggling with. So really the goal tonight is that if you are not incorporating music into your everyday life, into your rehab therapies, you're really missing out on a really effective, low cost, very low to no risk, powerful brain intervention. And so what I want to do tonight is talk a little bit about how music impacts the person with the brain health issue, the caregiver, really even the medical professionals and even healthcare systems. And why that matters is because if we are going to try to advocate for music to be a part of the medical field, let's face it, we got to talk in terms that really matter to the decision makers, which tend to be administrators. And a lot of times that comes down to how affordable can we make this? Is there a way to actually integrate this into our programs in a way that could actually save us money? And that's the amazing thing about music therapy. The power of music is once you really understand the research on it, it's overwhelmingly obvious that it is just a good idea from a physiological point of view, from a psychological point of view, from a financial point of view, from a point of view of getting your staff motivated and focused. There's so much good, solid information out there. So what we're going to talk about tonight is music therapy, specifically in the healthcare system. So at the most basic level, it's very safe to say that music has the power to transform lives, to transcend symptoms. So many times when we are stressed or traumatized, we can go very internal and become very closed because we are in the protective mode. And that is not good for a variety of things. We get more muscle tension, which leads to more pain, which may lead to more pain medication, right? It makes us not connected to other people who could maybe provide us with support. It increases our anxiety dramatically and makes our stress hormones come out like crazy. Actually affects things like your blood pressure, things like your cardiac output. There's just a way that music can kind of get behind the scenes, get into our limbic system, our emotional centers, and really, really work wonders in a way that words really can't. A lot of things that happen to us in medical systems are very stressful. We come to the medical community with a lot of baggage, don't we? I mean, just any of us think about walking into a dentist's office, right? And when you smell that smell, it's like you have to kind of work yourself down. Well, what if you've been in a hospital system when you had a life-threatening event like a stroke, or you had to get a brain shunt or a craniotomy, or you're waiting to hear about a biopsy? These are very stressful environments. And so if we're left alone with just the sounds of the healthcare system, the sounds of the emergency room of the hospital, it really amps up the anxiety. And so if we're able to build music in to healthcare systems, I think this is really one way that we can connect with human beings. We can take the environment from a very sanitized environment, which can feel kind of anti-human sometimes, and really humanize it and make sure that we're really attending to people's spirit and to their personhood and not just over-medicalizing what is going on. It also has been shown to improve outcomes and quality of life in people, in patients from the tiniest little babies all the way up to people in hospice and in palliative care. It can get through the most challenging of circumstances. There's some good data I'm going to share with you tonight about people who are waiting in the room to get very significant surgeries. And when they get music therapy, there's a lot of people that report they don't need medication for anxiety, okay? That they can just calm themselves enough with the power of the music. And then, of course, we don't have sedation issues, and it's just much more low risk. It is evidence-based. Music therapy at this point, there's over 600 good quality scientific studies about music in healthcare, music with different populations. It absolutely works when you do it a specific way, which we're going to talk about tonight. And it's like once you understand the power of music, you will want to scream it from the rooftops and advocate for it for everyone you know who's going through something. But you realize how much of a no-brainer, excuse the pun, that it is to incorporate into doctor's offices, into the hospital. Even in the emergency room, there's some studies where when they give people rooms with music and they ask them after, if given a choice the next time when you come in the emergency room, would you take a normal room with no music, or would you prefer that room where you could actually pick and get the background music you wanted? 100% of the people in this one study, 1,500 people, said, absolutely, give me the music again. There wasn't one person in the study that said that they would prefer not to have the option of the music. So it's pretty compelling data. It also lowers the cost of care. We're going to talk tonight about the top 10 scientific findings that I think really make the case for needing to incorporate music. But some of the most impressive stuff actually comes down when you look at how much less medical personnel you need to be in a room when there's music. You actually need less people to be there for surgeries. People have a much quicker outcome getting off ventilators. People get out of ICU quicker. Babies grow faster in the NICU when they're exposed to music. It's really amazing. And so one question, of course, is, well, why is that? Well, music is probably the most fundamentally human thing that we experience from the very first inklings of our consciousness, right? We are in our mother's womb and we hear the heartbeat, and that is percussion, right? It happens at a very specific beat. It has a very specific psychological effect on the baby, right? That is something that the baby wants to hear when it comes out of the mother's womb. That's part of the idea of putting the baby right on the mom as soon as she comes out, because that is a constant. It's a very comforting feeling. And so we know they kind of talk about it from cradle to grave. Music is a tool that we have that is able to calm us, to soothe us, and to organize us and motivate us. So I want to go through the top 10 scientific findings that I thought were really cool to share with you, so you could start to incorporate music into your own personal healing and recovery. Or when you go to the doctor or the hospital, maybe give them some feedback that have they ever thought about maybe incorporating music. So if you look at the scientific studies, any clinical population that they study, from women having traumatic births, all the way up to little tiny premature babies, to hospice, to palliative care, mental health, Parkinson's disease, Alzheimer's disease, pulmonology, oncology, rehab, intensive care, pain units, any study that has been done on any clinical population is basically very positive. And what I think is at the bottom of that is that they all have one thing in common, which is that they're all human beings, right? They're all people. And so what we really want to do is, instead of looking at it by how do people do with stroke or how do people do with dementia, I just really want to talk about it more broadly. I will give you some data specifically for some of the brain health populations I care a lot about, but this is really something that cuts across all people who are in some type of a medical context or having a medical crisis. So the first one is that music really can improve our mood and enhance our emotional adjustment. So what do I mean by this? Kind of goes back to what I said before. We can go from being very closed and internal and hypervigilant. That is something that happens to people when they're stressed, when they've been traumatized, where they're anticipating bad news, where they are worried that they're going to have a doctor, a stranger come in and all of a sudden be told they have to get a painful procedure. We're basically like lying in wait, very tense, not taking in a lot in the environment, kind of closed, right? So music is something that can really relax our central nervous system, can make our parasympathetic autonomic nervous system kick into gear and counteract that feeling of being so stressed and so tight. One of the big signatures of stress is muscle tension, right? And so when you are tense with your muscles, your breathing gets very shallow. Any type of orthopedic issue that you have is going to get worse, and you're just going to get very irritable because your nervous system is already running so high. Any little thing, a loud noise, somebody saying the wrong thing, it's going to basically tip you over the edge of frustration because you're just running on very, very little reserve at that point. Music also helps us to simply identify the emotions that we're having. How many times have you listened to a song and you just start crying and you didn't even realize you felt that way, but the lyrics or something about the melody or just the sound of an instrument, it just does something to you emotionally and makes you realize that you're having a certain feeling. When we don't release emotions, this is where we can start that downward spiral that ultimately needs to maybe needing some sedation, right? Maybe needing, people to come in and comfort us. But the problem is in the hospital systems, there's not a lot of time for that kind of stuff. And so sometimes if people get agitated, they can be put in physical restraints because they don't want to be in the hospital bed. That makes them feel very panicky. Sometimes people are given chemical restraints where basically they get a shot or they're given pills to calm down, but there's consequences to that. Sometimes we absolutely need them, but it can slow down our breathing. It can make it more complicated if you have to go into a surgery and have another type of anesthesia. We don't want people to be over-medicated. So if we have the option of getting some of that central nervous system tension down with music, something that is very readily available, even the person themselves, if they realize how powerful it is, can bring an iPod with them, a boombox, whatever. The TV in the hospital room, if they have a music channel, can be turned there. There's music therapists that come to the bedside. Now, there's all different ways that if the hospital system supports it, you can have access to something that is very low risk and is very, very effective. Music can also help us a lot emotionally with acceptance, being able to just make some type of peace and not resist what is happening to us as much. When we are resisting, we are not taking in new information. We are very, very overwhelmed. And in a hospital setting with a medical crisis, we are asked to do a lot of processing in a very, very short amount of time. And that leads any human being to feeling very overwhelmed. If we can sometimes take a break from the talking, sometimes take a break from the prodding and the poking, and just be able to listen to a song, get distracted for a little bit, go a little bit more into ourselves. It's amazing. Just even after one song, research has shown that people can kind of come back a little bit refreshed, a little bit renewed. There's also a sense, I think, that music helps us in the hospital environment to have some control over the situation, some control over what is happening to us. That is a very difficult thing that I don't think some emergency medicine medical providers necessarily get, that we lose a lot of control when we go into a hospital system, especially in an emergency room, right? So we really want to let people have options and let people have choices and not just feel like they are a body being moved around and pricked and being talked to, right? We want to make sure that we have a partnership and that we're going back and forth, and we give people a sense that their opinion matters, their comfort matters. And it's just amazing what the research shows, that if we give people the options of these 3 different types of music, people then report just a general sense of feeling cared for, a sense of feeling much more like I can handle this. There's a feeling of confidence that can come. And part of that is because we are very soothed psychologically by music, but also it really is a part of our identity for so many of us. What we know about music therapy is we don't just want to assume what type of music is going to work for that person. Music is very personal. It's very cultural. What might soothe one person might really agitate another person. You know, somebody might want to listen to AC/DC and somebody else wants Mozart, right? And if you mix up those two people with those two musics, you're not going to get the right outcomes. So it's really amazing, just the psychological soothing of giving a choice is really, really, really positive. For a lot of people too, if they do want to listen to spiritual music or religious music, it is a way for them to feel closer to God. This is a quote that we've seen in a lot of different research studies. It's also very positive for staff. If you start to ask rehab professionals, nurses, when they work in environments with music therapy, they will tell you things like, this is a very positive change for me. The more the patient is helped and is calm and is well adjusted, the better I can take care of them, the more I can do my job. Nurses will also tell us it makes me understand my patient more as a complex human being, and I really move out of the mode of just seeing them as a patient who needs my medical help. I see them laugh with the music, I see them get animated, I see them cry with the music, and it just makes me have more empathy and more compassion, and I know we would all agree that we need more of that in medicine today. The number two thing is that it absolutely directly and positively impacts our physiology. These things are not psychological. These things I'm about to tell you are actual biological things that happens in the body. So really what we're doing with music is impacting this parasympathetic nervous system. And what this does is basically reduces the fight, flight, or freeze response, which is such a normal response to when there's something threatening or traumatic happening in the environment. So with music that the person chooses and likes, our stress hormones go down, our endorphins go up, our breathing gets regulated, our blood pressure gets regulated, our heart rate evens out, we have less muscle tension. One of the coolest things is that the blood vessels can actually open up. There was one study where they showed that when people were listening to relaxing music, relaxing meaning that's their label for the music, that blood flow increased by 26%. This has a major impact on brain functioning because the blood is what brings the oxygen and the glucose to the brain, okay? It also helps to release nitric acid, which is something that is essential for the formation of blood clots. So there's a lot of work being done right now in hospital settings like ICU, where when people are too sedentary for too long, we get very worried about blood clots. So the idea is, hey, maybe if we have music in there as something else, in addition to blood thinners and all that support, is this yet another way that we can try to expand people's blood vessels a little bit? It actually has been shown to increase walking speed. Babies in NICU gain more weight, have higher oxygen saturation rates, eat more, and cry less when there is classical music playing. In folks with dementia, when music is playing during mealtime, there is better swallowing and less events of choking. And I just think that is absolutely amazing. But it doesn't just stay isolated to human beings. We know that when classical music is played to plants, we get better growth. Hens lay more eggs. Cats seem to stretch out more, and cows produce more milk. Now, the opposite happened when they played hard rock music, which I thought was hilarious. So it turns out for animals, classical music is a big one. The number 3 scientifically supported piece of evidence for music I want to share with you is that it has a lot of support for reducing pain and the need for medication. So music therapy patients report less pain, especially prior to any type of surgical procedure. Listening to music in many studies has been found to be more effective than prescription drugs in reducing anxiety before surgery. After a joint replacement surgery, people recover with less pain and less reports of nausea. If you have to give an infant a little heel stick to get some blood out of them for testing, they actually jump less, they startle less if there's classical music playing in the background. In kids who needed to get an EEG to test their brain waves, there was a 100% success rate in having to give them sedation when there was a music therapist in the room. There was an 81% success rate for getting kids into a CT scanner when there was a music therapist there playing guitar. In 1 year, in one study, they saved 184 hours of RN time. And so what this means is when there was a music therapist on staff, in 1 year, one nurse, instead of attending to patients who were having extra issues like extra pain, extra agitation, they were able to redirect their care to other people who probably needed it more because those people were being calmed and comforted and soothed by the music therapist. Classical music, we know, produces alpha brain waves. This is the brainwave state that makes us all feel relaxed. This is what we are trying to do during meditation, is increase alpha brain waves. Part of how we think pain and music go together is that music is a very powerful distractor. One thing we know that makes pain worse is when we focus on it. But the problem is pain is unbelievably consuming. There's a survival instinct that kicks in and you feel like, I have to pay attention to this because this is threatening. What if I need to be aware? When is it coming and going? How bad is it getting? And that actually makes the perception of pain worse. So one of the most powerful things for pain that we can do is to really distract ourselves in the moment and move some of our attention away from focusing on exactly what hurts. Number 3 is that music can increase positive and meaningful social interaction. It provides comfort. It eases loneliness. It eases isolation. It can promote a very positive interpersonal experience. And this makes me think a lot about caregivers. So one of the things that's so hard, I think, about being a caregiver is the changes in the relationship. So you can go from being husband and wife to caregiver and care recipient. And that is a very specific type of daily interaction. One is doing for the other. In music therapy, when there's music playing and there's a playful and a joyful and a light back and forth between the person, there's reports that it reminds people of, this is my partner, this is my spouse. It goes from kind of changing the mentality of we have medical interactions all day long to breathing some fun, some life, some lightness back into the relationship. And that is very, very powerful. We also know that people with dementia wander less when there is music being played. The next one I want to tell you about, I think we're up to number 4, is that music has actually been shown to kill bacteria and cancer cells. This is pretty intense. And really how it does this is through an antibody called immunoglobulin A. And this is basically in the mucous membranes of our body, like our mouth, our digestive tract, and our lungs. And when we listen to certain music, classical, we release more of this IgA, and it prevents infections from starting. Like I said, destroys bacteria. The times when they found that it gets released the most is when people are singing in a group, which is such a cool finding. And so during a rehearsal for a choir practice, the amount of IgA went up, 150%. And when people were actually performing, it went up 240%. So that is such a cool finding because it really speaks to, music as being kind of a social glue, and that what's really good for us is to be with other people and to be bonding and doing things in unison. So I would take that to mean even in your own home, if you and your spouse, if someone has a stroke, or I'm thinking of our friends Joe, and I know your husband has incomplete locked-in syndrome, going back and forth with him, trying to have any type of reciprocal exchange when you're listening to the music, that's when we really think that the immune system is able to kick in. The next one is it really helps to rewire the brain. Part of the reason is that music is very stimulating and organizing. One of the things that's very hard after a severe traumatic brain issue, whether it's a stroke or a mechanical TBI, brain tumor, is that the brain, its overall organization gets disrupted. The brain is so interconnected that even one little glitch somewhere can throw off the organization of thinking, of physiological symptoms, of digestion, of memory, of attention. we really try to go for unity in the brain. And so part of what can happen with music is the pattern of the music, the melody, the words, the rhythm, that creates an organizing experience for the brain. And that is very healing, because then the brain is firing together, wiring together, and we're getting more of the whole brain working together. Music perception does not happen in one part of the brain. You cannot damage a part of the brain and be unable to benefit from music. Okay, the only thing we worry about is if people have very significant hearing loss, but the idea is you could still potentially use rhythm by tapping on the person's body. Okay, anything that has a pattern is something that we know really helps the brain. Specifically, there's been research done on Mozart's concerto from the Baroque period, which has 60 beats per minute, and that's been shown to increase the amplitude and frequency of brain waves. So that might be something, you know, for folks with locked-in syndrome, or if you know someone who's in ICU and has a coma, whose consciousness has been kind of reduced, that would be a good way, I think, to have something in their environment to try to help their brain get back on track. We know that when folks with stroke are in occupational therapy or physical therapy and music is played, we get bigger strides in walking. People walk faster. People actually get more range of motion in upper limbs when there's music playing. I was just speaking with Healing the Brain with Jane the other day. She's an amazing occupational therapist, and she was saying that she uses music in every single OT session that she does, and the person gets to pick, so it's meaningful for them. But it really helps with motivation. We know it also improves brain function. People are more oriented when they listen to music. We can learn up to 5 times more. We can concentrate better. It brings up long-term memories. How many of us listen to a song and it's like, oh my God, I can't believe I remember these lyrics, or I remember exactly where I was when I heard that song. It encourages reminiscence, which makes us feel comforted. That is part of our identity, that we remember things that have happened to us in the past. We can also create more short-term memories when we listen to music, in part because it's emotional and we're getting that limbic system to basically support the formation of the new memory. We also know that singing is an amazingly powerful form of speech therapy. There are many people who have injury to the left hemisphere of their brain, right around here, either in the speech production center or the speech comprehension center, and they cannot speak, but they can sing. And part of that is because we think singing actually happens in another part of the brain. And so singing therapy, melodic intonation therapy, is very powerful. It's one of the things that Gabby Giffords used to be able, she was our Congress woman who was unfortunately, there was an attempted assassination and she was shot in the head, and she has really used singing therapy to get back a lot of her speech functions, which is really powerful. We also know that when people are in the hospital and they have music therapy, they have less invasive procedures, they get out of the hospital earlier, and it reduces the cost of care. So I said this before, people can transition off ventilators more quickly when music is played. Mothers leave the hospital earlier after a traumatic birth. The stay after a radical mastectomy or an ICU stay is shorter when the person receives music therapy. In hospice, getting music therapy reduces the cost of care by almost $3,000. In the NICU, you can cut the cost of taking care of a baby by about $10,000 across the whole admission. When children were needing to have an echocardiogram, they were able to get the cost of that procedure down by about $75. They were able to need no medication, and they didn't even need an RN in the room, which is kind of double savings. So those are pretty powerful statistics, and I'm really hoping that when you hear these things, they create a certain enthusiasm and a feeling like you want to get out there and advocate for this stuff, because again, it's very low cost, almost no risk, and it's giving us these great outcomes that are very tangible. We also know it increases hospital satisfaction. People who get music therapy and their families, they just complete those satisfaction surveys more. They recommend the hospital more. They report feeling more spiritually and emotionally supported by the hospital and hospital staff. We know that the future of medicine has to be more patient focused, right? And how do we do that? How do we actually put that into action? I really think that music therapy is one of those small ways that we can just acknowledge the humanity behind patients and not just medicalize and sanitize every type of hospital patient experience. We really have to acknowledge that we're trying to take care of human beings who have complex psychological needs. Okay, and the next one I want to talk about is some of the benefits to caregivers. So we talked about this a little bit before, that it creates a different kind of experience. People need less medications to help with agitation, so-called behavior symptoms after TBI or dementia, when there is music in the environment. So my goodness, let's take advantage of that. So this all begs the question, what kind of music, right? How much music does it take to make a difference? Well, the key seems to be, according to the research, personalized music. Music that is chosen by the person, that is something that is meaningful to them and that is appropriate to the context, right? So we're not going to want, even if someone does like rock music, you're not necessarily going to want that before a cardiac surgery, right? But maybe when you're in your rehab and you're doing cardiac recovery and you're learning how to become a little bit more cardiovascularly active, maybe that's the time you want to bring in your rock band, and that gives you a little bit of motivation to get going. We really want to make sure that we are giving people choices about their music. We know that the music from the time people were about 17 to 25, just historically, statistically, seems to be the way to kind of get into the emotions the most. So that would be my recommendation if you have someone that is kind of really internal or shut off or is having some trouble with communication and consciousness, is to learn from their friends, their family, think back to when you know them during that time. What were they doing when they were in their late teens, early 20s? That is something that could really, really kind of connect with them and help bring them back out. In terms of how much music therapy people need, basically the more the better, but even one session can be very, very powerful. I want to recommend the documentary Alive Inside to any of you who have not seen it. It is absolutely amazing, and you'll be able to see with your own eyes and feel with your own heart all of the statistics and research that I've been talking about tonight. So it's a way to kind of make it come to life a little bit more. Music therapy is a standard of care now in children's hospitals. It's becoming a standard in things like hospice and in cancer centers. Music therapists are being brought in more, but we also can pipe it into common areas. We can have live concerts. We can give people iPods. We can have music channels in the room. Some hospitals are actually part of the pre-admission process inviting patients to make a playlist. So when they are in their room, their personal music can be played. One hospital even developed a department of sound. And all these folks did was try to decide what music was appropriate for what setting in the healthcare system. And I thought that was a very thoughtful step forward. So the bottom line, though, is once you know all this amazing, compelling data, what are we going to do about it? And if you've been watching me, I hope you know that's kind of my whole thing, is once you know better, you have a responsibility to do better, right? So incorporate it into your own personal life, your loved one's recovery, but also get out there and talk about the power of music. It's one of those things where we can almost think it's, oh, that's playtime, or that's for fun, or you do that when you're at home. No, this research suggests that it can be an integral part of healing in the medical world. And it's so cheap and it's so readily available. It's really kind of a wasted opportunity if we don't get out there and do it. So talk to your people, your medical providers about, hey, did you ever think of having music in the waiting room? Or, hey, I've been waiting in this room for 20 minutes for you to come in. Would have been cool if maybe there was some music in here. Maybe my anxiety wouldn't have gotten quite so high. We need to donate to music-based programs. There's a fundraiser happening in my community this week that I'm going to be a part of, and I hope to excite people about the power of music therapy and basically help them make that transition to actually putting their money where their mouth is, because these things take wiring. You got to buy iPods, you got to do talks in the community to help people get behind the idea. So I think really what I want to leave you with tonight is this question, which is, once you understand the power of music, once the healthcare world understands the power of music, do we have a responsibility to integrate it into healthcare? Without it, are we missing an opportunity to affordably respond to the human need for comfort, right? For hope, for meaning. And this cuts across patients, caregivers, and medical providers. When we're not spending money, cheap, low level of money on music therapy, are we really just wasting money on medications, on medicalizing the medical system even more, when really what patients want, what many of us doctors want, is we want to move in the opposite direction and humanize the medical system. So I think it really comes down to the question of, do we value music enough to support it and advocate for it? So what I want you all to do in the comments is, I want you to tell me, how have you used music therapy? What music makes you feel more motivated to do your rehab, to do your recovery? Has music been a part of your soothing, your comforting? Do you think that maybe it would have helped you more when you were in a traumatic medical situation? Can you imagine that if you would have given the option of listening to some kind of music or having someone come into your room, that maybe that would have helped your caregiver? It would have maybe broken the intensity of the clinical medical stuff that was going on, and kind of brings you back to you, brings you back to your heart, and that you're a person who is in there going through something very stressful in terms of your body. So I think it's super interesting. I think it's super compelling. This lecture gave me a chance to really learn more about the science behind music, and I absolutely encourage you to use it every single day as you try to walk this walk of brain health recovery. Thank you guys so much for being here with me. Please share this video if you think that it was helpful, if it was useful. I do this really to try to reduce suffering that comes from not having enough good quality information, or just having the ability to hear the thoughts of a well-trained, compassionate neuropsychologist. So I appreciate being here with you guys very much. I'll see you again next week, and I hope you have a great week. Bye-bye.